Good morning, everyone, and welcome to another edition of nclexsession. So my purpose here mainly is to get you familiar with the day-to-day for nursing and understanding what is the most priority, what's the main focus of what you need to do in a particular situation. Why is this important? Well, this is what we do every day. And for you, especially if you are a student listening, it's important because on the NCLEX exams, they are focusing on what is priority. And when I say that, I mean that all the answers usually are correct. That's the tricky thing about the NCLEX exam as opposed to a regular English course or a math course or a science course in college. You know that A, B, and C is completely wrong and D could be the only answer. Okay? In nursing, it's a whole different situation. A, B, C, and D, they are all correct, but only one is the most priority. Or better still, you have to look at the question. The question might say, what's the priority? Or the question might say, what is the second step or the next step after you do the main step? So you got to kind of look at what the question's asking you and dive into, okay, what are they really asking me to do here? Is it, so that's what nursing's about, because it's about thinking, critically thinking usually, and putting things in a hierarchy. What's most important, what's least important, and most of the basic necessities of life. Like if you see, okay, the patient is really hungry, what's more important, let me get this patient's food, or the fact that the guy's barely breathing when he's explaining to me how hungry he is? Should I focus on maybe giving him some oxygen, or should I focus on getting him that cheesesteak sub that he really wants? What is most important? Why rush to go get the food when the person might be dead when you come back because they couldn't breathe? You got what I'm saying? So both are important. He has to eat, but guess what? He needs to breathe too. Breathing is probably more important than biting into a sandwich. Just saying. So nursing and anything medical is very different than your other basic courses that you had to learn just to get this far in your career or even to the end of this nursing journey so that you can now take your NCLEX exam. Okay, so I have a combination of all different types of questions, because in the real world, you're going to jump around to different things. It's not going to be everything airway, everything about food, everything about skincare, everything about whatever. It's going to be a combination of different things because you're going to see a combination of different types of patients. You may have a team of, let's say if you're on in an ICU, you may have a team anywhere from 1 to 2 patients. Unfortunately, sometimes with some of us, we've had up to 3 patients on an ICU unit. That's usually not too safe, especially if you have someone with a lot of critical drips. But on average, it's supposed to be 1 to 2. In an IMC, intermediate care, which is a step down from the ICU, that's usually about 4 to 5 patients. And when you go to a PCU, which is a step down from the IMC or intermediate care, the PCU are patients that are still on a telemetry monitor. They still need their heart to be monitored and assessed, their rhythms and things of that nature. You're usually looking at about a ratio of 1 nurse to 6 patients. And then if you are on a med-surg unit, which is a unit where the patient does not need to have a monitor for their heart, so no one's looking at their heart rhythms and they're measuring their strips and things of that nature, you may have anywhere, from 8 to maybe 10, 12 patients, depending on the type of unit, depending on the nurses available for staff that day. Maybe you're supposed to only have 8 to 1, but maybe you now have 10 to 1 because maybe someone called out sick or someone's going to be delayed arriving or anything. And if you do long-term care, my goodness, long-term care, you're looking at, you may have a floor with 60 patients on that one floor. Of those 60 patients, you may have 2 registered nurses. One registered nurse takes 30 patients and you take the other 30. Okay. And of each of you guys have 30 patients, and each of you guys may have maybe at least maybe 1 to 2, hopefully at least 2 CNAs, certified nursing assistants, for each of your teams when they're focusing on baths and feeding the patient and changing the patient and turning the patient and helping the patient get dressed and things of that nature, so that the nurses can focus on things like medications and wound care and stuff like that. Because in a long-term care facility, remember, they're sick, but they're not as critically ill as patients you're seeing in the hospital. So of course they look at the rationale of, we can give you 30 patients because they're not literally at death's door. They mainly need their wound care done. They need their medications and their other treatments. It could be they could still have an NG tube being fed that way with 2 feedings and different things like that. But it's not critical. You don't have any drips hanging. You may have an IV fluid, like maybe some normal saline or some D5W, which is dextrose with water, something like that, but nothing like a propofol drip, which is sedative to keep the patient asleep so they won't pull out their trach, or cardiac type medications like a cardizem and things of that nature. So in that environment, the nurse can have a lot of patients. Okay, so I'm just giving you a spiel because I have been a nurse for over 20 years, and I've done, oh my God, everything, just about everything except for the OR. My background is in critical care mostly. So I do critical care, trauma 1, trauma 2. I do acute care. I've done emergency room. I've worked in a cath lab. I've done case management. When I say case management, I'm mainly talking about short-term disability, that type of case management. I've done home health. I've done occupational health. I worked for an energy company at one time in Maryland, and I was in charge of all the assessments and physicals and all that stuff. I even had my own hearing booth in my office, and they had me go back and get certified to be, a hearing conservationist, which I went to Johns Hopkins to get that certification that lasted for 5 years. I've also done a skilled nurse facility, which is a long-term care. I've helped out there as well, which is why I can speak to the fact that you can get 30 patients, because I have got 30 patients before. Oh, yeah. I've also done prior authorization, which is working for an insurance company, authorizing certain treatments and things for patients. My arena was in the home health sector, so authorizing things in that nature for home health, pediatrics, and adults. And I've also been in leadership as well. Manager, house supervisor, charge nurse, things like that. I've also been an educator in a nursing area in terms of precepting new graduates, precepting new nurses on the unit, and teaching a team of nurses on our unit or my team. And also now I have a master's degree and I'm actually a professor also. And so yeah, I've done some of everything. And like I said in the last video, I was going to share a little bit more about my background, so you have an idea of when I say what I say and I explain what I explain, I know what I'm talking about because I have lived pretty much everything I'm talking about. Okay, so this is real life. All right, guys, so that was a kind of a long spiel. Let's get to some of these questions. Okay, question 1. Upon entering your patient room, you notice that they are having a seizure. What is your first action? Is it A, call for help, rapid response team? Is it B, obtain the current set of vitals? Is it C, position the patient on their side to maintain their airway? Is it D, administer oxygen? Now, like I said earlier, guys, when we started this video, in the nursing situation, all the answers are usually right on the NCLEX exam, but only one is priority. What is the question saying? It's saying, what is your first action? Not your second, third, fourth. What is your first action? They're asking you for what's the most important thing to do at that very second. Again, this is real life, guys. So if you chose answer C, which is position the patient on their side to maintain their airway, that is the most important numero uno priority prior to the next important thing, which is calling for help and rapid response team, okay? Because the main thing is that you need to protect the patient's airway to ensure that they can breathe effectively. So when you position the patient on their side, which we also call the recovery position, it helps to prevent aspiration of saliva or any vomiting that can occur during a seizure. And for everyone should know what aspiration means, but pretty much that means, let's say that saliva in that person's mouth or that vomit that's coming from their tummy, they can, when they take a deep breath in as they're breathing in and out, that can go into their lung. So now you have saliva in the lung, you have vomit and food particles in the lung, and now we really have a situation. So you don't want that to happen, so you position the patient on the side. So when they're vomiting and things of that nature, it's coming out of their mouth onto the bed or onto the floor or anything, as long as it's not going in their lung, okay? And of course, rapid response team would probably be the best second answer. And it's just a given. You're going to be doing vital signs and oxygen and all that's going to be following that. But most important, position the patient on their side to maintain their airway. And then the second answer would be, to call for help, and that's a rapid response team. Question number 2. The RN must administer 80 milligrams IV push Lasix to a patient whose legs are severely swollen related to CHF, also known as chronic heart failure. The nurse is aware that furosemide must be pushed slowly for which reason? Is it A, to prevent nausea? B, the patient may urinate too fast? C, to prevent hearing loss? D, to prevent a rash? Again, let's look at all these choices. And remember what I told you earlier. In nursing, usually there are questions and exams, because it's based on real life. They're usually all right or partially right. But what's the main thing to grasp from this question? So let's look at the end of the question. It says the nurse is aware that furosemide must be pushed slowly. For which reason? Why should we be pushing the Lasix, also known as furosemide, because you need to know your generic names of your medicine, as well as your brand name, which is Lasix, which I know you've learned that in school. Because you never know how the doctor's going to order it. Is he going to put the brand name? Is he going to put the generic name? You need to know both. Just like the pharmacist, you need to know both. Okay, so why are we pushing it slow? So if you chose C, to prevent hearing loss, you are correct. Okay, so Lasix, it is also known as furosemide, and it is a diuretic medication, and it is used to eliminate that excess fluid and salt through the patient's urine, okay? So when we administer Lasix through the IV route or intravenous route, it's recommended to push the medication slowly, especially when the doctor orders a bolus like this. 80 milligrams is a lot of Lasix. Okay, commonly you might see 20 milligrams and maybe 40 milligrams if the patient, has swollen legs and they're having some trouble breathing. But a lot of times you'll see a lot of 80 milligrams of Lasix because there's so much swelling and the fluid is now going into the lungs and all these other problems with a patient, especially someone who has chronic heart failure. So when you push it slowly, it's recommended to do that because it can cause an ototoxic effect. And how is that caused? Well, rapidly infusing that Lasix causes a sudden drop in our serum electrolytes, mainly potassium, and that can cause an electrolyte imbalance that's usually associated with hearing loss and other ear-related issues such as tinnitus, ringing in the ear, and things of that nature. So, it also causes other problems too. If we're talking about ear, nose, throat, also causes blurred vision as well. My goodness. So, does it cause nausea? Yes. Does it cause a rash? It's possible. Will it make the patient urinate too fast? We're not usually concerned about that too much because the patient usually has a Foley or, a bedside pan or urinal or whatever. So that's not major. What's major is preventing the patient from going deaf. You don't really want to tell the family member, I was taking care of your dad. I'm so sorry. He's now having hearing loss because I was in a rush to get to the next patient. And I went on and pushed this Lasix really quickly. And, he's having some problems. You might want to consider hearing aids. Yeah, that's not a good look. That's just saying. So, yeah. Hope you did well on that question. Question 3. The nurse receives an order to obtain a D-dimer level. The primary purpose of the D-dimer test is primarily to do what? Is it A, assess the thickness of blood? Is it B, identify the presence of a blood clot? Is it C, monitor electrolyte concentrations? Or is it D, evaluate the patient's INR for Coumadin? Now let's look at the choices. So D is saying evaluate the patient's INR level for Coumadin. Automatically that's wrong because the actual test they ordered was a D-dimer. They didn't order an INR. So that's automatically alleviated because that isn't even a test. It's a whole different test. Okay? And of course the INR is normally something that you draw so that we will see if the patient is therapeutic on their Coumadin or not. Okay? So I'll save that for a whole other question. For C, we have monitor electrolyte concentrations. Well, this is wrong, completely wrong, because D-dimer tests or D-dimer blood levels is not for that. If the doctor wanted to monitor the electrolyte concentrations, they would order something like a CMP, which is also called a comprehensive metabolic panel, or it's also called an electrolyte panel. Usually in the hospital setting, you're going to see CMP. Comprehensive metabolic panel. They're not going to spell it out. It'll just say CMP. Okay? And that test is used to find out if your body has any fluid imbalances or an imbalance in acid and base levels, and the electrolytes are also measured there as well. Okay? So that's not the answer. So if you look at A, to assess the thickness of blood, that would be more related to the D answer, like the INR. Also, assessing thickness of blood may be the PT-INR. Let's say you have, APTT. Let's say you have the patient on heparin, okay, which is a blood thinner. A lot of times we put the patient on heparin prior to getting them on Coumadin, or while we're waiting for them to get therapeutic on their Coumadin, okay, which is like A is kind of more related to D, unless we're also talking about heparin. Again, not trying to confuse you, but A is not the answer. Neither is C, neither is D. So why is B the answer? And if you guess B, very, very good, okay? B says, identify the presence of a blood clot. Now first you may say, well, what is the D-dimer test for anyway? Okay, well, the results indicate the presence of an increased level of D-dimer in the blood. D-dimer is a product of breakdown of fibrin. What is fibrin? Fibrin is a protein involved in blood clotting. When blood clots are formed and then dissolved in the body from fibrinolysis, D-dimer is released into the bloodstream. So again, blood clots are broke down or lysed, which is AKA the same as lysis, O-L-Y-S-I-S, the breaking down of the fibrin, okay? And as it's broken down, D-dimer is released into the bloodstream. So we're looking for those D-dimer levels. So if the D-dimer is positive, this can suggest that the patient has a blood clot. This is what the doctor wants to rule out. And a lot of times you'll see this ordered if, let's say, you have a patient with, let's say they have their left leg swollen, not their right, or their right leg swollen, not their left, or one of their arms are swollen. And you're like, okay, what's going on here? The doctor might say, you know what, let's order D-dimer test. And I'm not talking about a patient, let's say, had an IV that infiltrated in that arm. Let's say there was no IV there, and it was just some swelling, and the patient also said, oh my God, it's pain here, it's sore, it hurts when you touch it may be red. Yeah, it's not good, not good. And definitely not good if it's in the leg, because you don't even want your patient flexing their foot, because you're afraid that they may move that clot, further up and, cause some more problems. I mean, a clot can lead to stroke, a clot can lead to a pulmonary embolism, which pretty much is almost an instant death, okay? So if it's a clot in the leg, we call that a deep vein thrombosis, or DVT. If it's a clot in the lung, we call it a pulmonary embolism, or PE, okay? Of course, there can be all different other kind of clots as well, but those, that PE that's the one that's really deadly, okay? Yeah, and of course, if it's a clot in the brain, oh my God, that's a stroke, okay? Big possible stroke there. So it's really important in that way. Now the doctor can order medications to break the clot down, or decide if he's going to manually have it removed surgically, or what they're going to do depending on where the clot's located in the patient's body and what kind of problems the patient is having because of it. Okay, so very important, and you're going to see D-dimer levels ordered all the time because this is a very common test. All right? Question number 4. You have an order for Synthroid, 300 micrograms every day. It is supplied as Synthroid 0.1 milligram tablet. How many tablets will you give? Is it A, 1 tablet, B, 2 tablets, C, a half a tablet, or D, 3 tablets? I will give you a brief moment to get your paper pens out or calculate in your head, or however you do. If you need more time, please pause this video and then go on to the next slide while I broke it down for you on how to calculate the answer to this question. You can use the following calculations. So what you want to first do is convert your 300 micrograms to milligrams. Okay? So 300 micrograms is equal to 0.3 milligrams. Okay? Then you want to divide the total required dosage, which is 0.3 milligrams, by the dosage strength per tablet, which is 0.1 milligrams. When you divide it out, 0.3 milligrams divided by 0.1 milligrams, it equals 3. 3 tablets. Question number 5. Mrs. Smith has a new order written for 0.9 normal saline to be run at 125 milliliters per hour. How many liters of fluid would the patient receive in 1 day? Is it A, 1 liter, B, 2 liters, C, 3 liters, or D, 2.5 liters? I will give you a few minutes so you can get a piece of paper out and calculate it, or some people can calculate in their head. That's fine as well. If you need a little bit longer, go ahead and pause the video and finish doing your math equation to figure out this answer. And for those of you that already quickly did it in your head, if you chose C, 3 liters, you are correct. Now on this following slide here, I am showing you a simple way to break it down. Okay? So to calculate the amount of fluid that Mrs. Smith received in this one day of the 0.9 normal saline at 125 milliliters per hour, you can first just calculate the total amount of fluid per hour. So what are we saying in the question? We're saying she's getting 125 milliliters. Milliliter is the same as a cc, so if you use cc's, that's fine. They're interchangeable. So 125 milliliters per hour. Okay? They've already given you that. Then the second and last thing you do, very simple, is multiply 100 milliliters per hour times 24 hours. Why? Because there's 24 hours in a day, right? And we're trying to find out how much fluid the patient received in one day. So you have to break your day down to hours, because in the question they're giving you milliliters per hour. So you have to multiply that by hours to hours, okay? So 125 milliliters per hour times 24 hours equals 3,000 milliliters. Using your decimal point, 3,000 milliliters converts to 3 liters. Why? Because there is 1,000 milliliters in 1 liter. Okay? A simple conversion. So yeah. For any of you guys that feel you need more help when it comes to doing dosage calculation type questions, feel free to leave a comment in the comment section, and I will do a video solely based on different types of medications we give in a hospital, different calculations you're going to see on an everyday basis. Pretty much nursing is, my major was engineering before I switched to nursing, because I got bored of engineering, drawing, that kind of thing. Even though I loved math, loved science, okay? So I went up to, Calc 2, and there was really no need for all that. For nursing, it's just simple Algebra 1. It's not even Algebra 2, just Algebra 1. So if you know your basic algebra, you're going to be fine through all the medication dosaging throughout your career. It's just basic Algebra 1, okay? So if you need help with that, or different, like I said, different formats to calculate medications, feel free to leave a comment and I will make a video devoted to that. But for the majority of you guys, remember, we learned all this stuff in nursing school, okay? And if your school was anything like mine, my goodness, every single semester they started off with a dosage exam. And with our school, the students had to pass the dosage exam with 100%, not 90%, not an 85, not a 95. Our school required you to pass at 100% perfect score for you to continue on to the next semester. And they gave us a dosage exam every single semester before we started a new semester, okay? And someone might be saying, well, that's a bit harsh. How dare they? You know, an A is an A. Why can't a 90 count or 95 count? But the school's rationale, and I agree with the school's rationale, is simply, well, if you're doing dosaging for a patient, do you want only 90% of your patients to survive because you dosed them wrong? Or do you want 100% of your patients to live? So leaving it saying, okay, you did okay, kiddo. You got a 90% or 95. That's pretty much saying, okay, it's okay that you killed 5% of your patients or 10% of your patients. Oh, well, you know, luck of the draw. Yeah, no one's saying that. So my school made sure everyone had to get 100%. If you didn't get 100%, well, you're going to be taking the test over because they're not going to let you continue on to the next semester. I love that. You know, I'm a little anal when it comes to things of that nature, because my patients are my life. My patients are everything to me. And their safety is numero uno. So, oh my God, doses calculations? I mean, literally a nurse can kill a patient if you don't know what the heck you're doing. So, yeah. And why is this question important? Because a lot of times, very often, you'll have a doctor call you up, maybe in the middle of a night shift or in the middle of a day. It could be even a weekend, and he's, at the golf course, and he's like, hey, I'm just curious. I know we wrote this order on Thursday to give this patient 125 milliliters per hour. Can you just tell me roughly how much fluid has my patient received? Because I'm debating if I want to change the order. And they want to know on the spot, well, how much fluid? You may not even know why you're being called to the phone, except for a doctor, whomever is on the phone. And he wants to talk to you about patient X, Y, or Z. And then right on the spot, he'll ask you this question. So really, something like this might be good to learn how to calculate in your head, because he may not feel like hearing you say, well, wait a minute, let me get my calculator and my piece of paper out and da-da-da. And he's about to tee off, while he's playing golf, because you get those kind of calls a lot. Doctor's not around, or he's in between patients, or he's at another facility seeing his patients, because a lot of doctors have patients at more than one facility. They may have private practice. They may also have, they're obviously patients in the hospital as well that they've admitted. So, or they could be on the golf course. I've had that a lot. Okay. So, very important to know how to do this. Okay, guys. Question number 6. Mr. Thomas has a physician's order for a paracentesis. The nurse recognizes that the primary intent of this procedure is to A, remove fluid from the pleural cavity, B, drain fluids from the legs, C, remove fluid from the peritoneal cavity, or D, remove fluid from the pericardium. Okay, let's first look at what the answer cannot possibly be. Okay, so let's start with A, remove fluids from the pleural cavity. Now, that is a definition of a thoracentesis, not a paracentesis, but a thoracentesis. And that's a medical procedure which we use to remove fluid, because it could be blood or air, that has accumulated in the pleural cavity. And the pleural cavity is located between the lungs and the chest wall. So the space between that lung and the chest wall. Okay? So a buildup of fluid or air in this space is also known as a pleural effusion or pneumothorax. Okay? And a lot of times this can occur due to conditions such as pneumonia, heart failure, lung infections, or other kinds of chest injuries. I mean, the person could have been in a car accident, okay? All right, so usually during a thoracentesis, a needle or a catheter is carefully inserted into the chest wall, into that pleural space, to drain the actual fluid, or most cases, the fluid's been blood, okay, or air, which can relieve breathing difficulties and facilitate diagnostic evaluation of the fluid. Because what if we want to find out if that fluid that's in that space accumulating is infectious? So, we send a sample of that fluid to the lab, and they'll let us know if there's something wrong there. Do we need to order a range of antibiotics, or what's going on? So again, thoracentesis is to remove fluid or air from that pleural cavity, okay, which is between that lung and chest wall. So the question says paracentesis. So automatically that's wrong. Okay, you see why now you have to learn all this stuff in anatomy physiology, because this is now where you're pulling that information from what you learned from those two courses, anatomy physiology part 1, anatomy physiology part 2, all of that, okay, to understand how to answer this basic question. And you see why that class was really important. It's important for a lot of reasons, but definitely this one as well. Okay, so now let's look at, what do we have left? Draining fluid from the legs. So no, we usually don't even do that. We usually give the patient some Lasix, Or we'll do some non-invasive things such as prop the patient's legs up on a pillow and things of that nature, and using gravity to drain the fluid from the legs. So, yeah, not a paracentesis. That's definitely not the answer there. Yeah. So it's not B, it's not A. So let's look now at D. Remove fluid from the pericardium. So we know it's not this answer because if we're removing fluid from the pericardium, it's called pericardiocentesis. Pericardiocentesis is a procedure done to remove fluid that has built up in that sac around the heart or around that pericardium, which is the heart, okay? So this is usually done by inserting a needle and a small catheter to drain that excess fluid, okay, in that fibrinous sac that's known as that pericardium sac that surrounds that heart, all right? So, yeah, that would not be the answer because we're saying it's called a paracentesis, not a pericardiocentesis, okay? And, yeah, And some of the giveaways and some clues that you can also use when you're taking these exams is look at the actual word paracentesis. Notice it doesn't have the word cardio in there at all. Nothing in there about cardio, okay? So knowing the definitions of these words is huge, but again, you learned all this in anatomy and physiology. All right, so the last choice and correct answer is remove fluid from the peritoneal cavity. So the paracentesis is a medical procedure that is used to remove fluid that has accumulated in the peritoneal cavity. Well, where is this cavity? It's the space between the abdominal organs and the abdominal wall. Okay, so this fluid buildup is also known as ascites, and it can occur during various conditions such as liver cirrhosis, heart failure, kidney disease, and even certain cancers, okay? And that's just to name a few. There's some other issues as well with that. But mainly during this procedure, you insert a thin needle again and a catheter, and it's inserted through the abdominal wall to drain the fluid, which can provide relief and discomfort, from the patient, and allow that healthcare provider also to analyze what's going on with this fluid here. What kind of buildup is this? Is this some kind of infectious material? Do I need to, get, my infectious doctor in here? Because we have some doctors that specialize primarily in infection. So that's their main specialty. What medicines to order to clear up a really serious infection for a patient. And sometimes we'll do a consult with those doctors. And other doctors, they may just order it themselves, whatever antibiotic they are choosing to use at that time. Okay? So I hope that makes sense to you. I want to break it down a little bit so you understand the definitions of the different words and how you would break it down in your mind if you were actually taking this exam and you had that type of question. Okay, guys, so I hope you got a lot out of this session with me today. Feel free, please, to leave comments, suggestions, anything you want to learn more about, and I will make a video about that for you. If it's something you have to ask me one-on-one or a specific question related to an exam, let's say it was an exam that you failed. Hopefully that wasn't the case, but let's say you did. Or if it's not the NCLEX, let's say it was an exam in school and you're still in school and you haven't got to the point where you're ready to take your NCLEX yet. And you need further explanation, or you just don't understand why what you chose was wrong and you need someone to break it down a little bit more for you. You can feel free to leave your question at my email address, which is admin@skillsnacks.org. And I will have that actually on the screen. And also, if you look below the video, it'll be written there as well. And you can contact me to ask whatever specific questions that you may have. If you want to make a general comment, just leave it in the comment section of the video. So please like this video, subscribe to this video, and definitely share it with some of your coworkers who are already nurses who may be having some issues with a few things that you may have noticed on the job, or even, share with your fellow students so they can do well in the NCLEX as well. Okay, so definitely like and subscribe to this video, and I really appreciate your support, and thank you for listening in. Hit that bell for notification so that when I release another video for you to help you learn and soar on this exam, and also soar also in your field after you graduate, because you're going to be seeing this every day. Hit that bell so you can get more videos and information coming up. Okay, you guys have a wonderful day. I love chatting with you. Bye-bye.